The family safeguarding model means that families that we're working with are able to access support much quicker, linking in with the adult workers in terms of domestic abuse, substance misuse, and mental health in terms of our recovery and wellbeing workers. It means that there's not lengthy referral forms, nor are there lengthy waiting lists for families to access that support, which is very much needed at that time, meaning that the correct interventions can be offered and that the right support is in place for our families.
The changes I've seen with families I'm working with is incredible. We have been able to reach out to families and offer parents and carers support whilst empowering them to be the best they can be for their children at the same time.
One of the immediate benefits of the domestic abuse adult team is that we can respond quickly. Ordinarily, a high proportion of cases progress via the police to the lighthouse to our community SPOC team. Being in-house allows us the flexibility to immediately investigate the domestic abuse concern.
What we have done is we have removed the stigma around drug and alcohol support, and we have taken the support to them in their own home, where they feel comfortable, more relaxed to work with us and open up with any issues that they may actually have.
Some families have given some really good feedback in terms of the access that they've been able to gain to services, and just how they feel supported by children's social care. Some families who have worked with children's social care previously have stated that they can see a shift in the support that's being offered and the way of working.
I've recently supported a mother of two with her alcohol use, and she's now volunteering with us in Somerset Drug and Alcohol Service, helping others in service. I feel this would not have happened without the family safeguarding model. Being able to work so closely with social workers, domestic abuse workers, and mental health workers is invaluable, and we are able to work better, more efficient, and quickly for the families because of this model.
I'm currently working with a perpetrator of domestic abuse. We're exploring his emotions behind his anger and introducing healthier responses to enable him to be a better father to his children.
I've got one family in particular who are working with all three of the adult workers. We've actually got two different recovery and wellbeing workers involved because mum and dad felt that they would benefit from working with one of the recovery and wellbeing workers. So that's great that across teams we're able to share the adult workers, again ensuring that the families that we're working with are receiving the right support.
So families, we believe that everyone deserves to belong. So we recruit and train volunteers from the local community to get alongside and build relationships with families because we want everyone to feel that sense of community and that sense of belonging. And our model fits brilliantly with the Family Solutions Somerset model. We are very much focused on what the family need and the family lead the support that they give. And that means for a mum, it might be that she says actually she wants a volunteer who's going to get alongside her and build that relationship with her. It might be that she actually says, I want some support for my son, and we're able to find that support and put that support in place to make sure it's, like I say, the family that are leading that support.
I'm the advanced practitioner in the FDAC team, which stands for Family Drug and Alcohol Court. Launching FDAC in Somerset as part of the Family Solutions umbrella last year has been really positive. One positive scenario has been supporting parents to build better relationships with professionals. This has been internally with children's social care and externally with wider agencies such as the mental health team and drug and alcohol service. The parents have reported that they feel valued and heard, where in previous proceedings that they have experienced, they feel that they have not been listened to. This for me is a significant difference between FDAC and standard care proceedings.
Pause Somerset launched in June 2020. Pause works with women who've had multiple children taken into care. In the last 12 months, we've worked with 20 women. 18 of those women are still with the service, and those women have had between them over 60 children removed into children's social services care. We work with women in a trauma-informed way, supporting them around the challenges that they face in a way that motivates them and in a way that gives positivity for the future. Some of our huge successes with women this year have centred around accommodation, around their relationship with their children, and around their motivation for change for the future. We're optimistic. With additional support, those women are going on to do some incredible things, and the relationships with their children are improving day by day.
Hello, my name's Julian Worcester. I'm the Director of Children's Services in Somerset. I've been in Somerset 6 years. One of the real strengths of Somerset is the involvement of young people. They've recently been involved in work we're developing with residential care providers, and they went and visited a range of children's homes across the country to work out who should be the best children's providers for children in Somerset. We have flexible working, so we don't expect everyone to be in the office 5 days a week, just to be clear about that. But we want to make sure that people are supported in their home environment to do very complex and emotionally challenging work. So helping you with the emotional support of the work we do is very important, because I recognise how challenging that is. I can still remember some of my early cases as a social worker where, visiting families, having to intervene in children's lives. If you're passionate about children, passionate about making changes in life, as you hopefully you hear, I am, it's important that you think about Somerset and coming to join us. So hopefully see you all soon.
I'm Mel Locke. I'm the Director of Adult Social Care in Somerset County Council. So our vision for adult social care in Somerset is that we want people to live healthy, independent lives, supported by thriving and connected communities, and timely and easy access to affordable, quality care that supports each and every individual to be the best they can be. There are great opportunities for career development. So if you want to move up the system, if you want to continue to develop your career, Somerset is a really good place to come to do that. We have great training on strength-based practice, on asset management, and most importantly, we tailor our training to each and every individual. We have fantastic tools around effective peer forums. How do we work together? Our communities, our voluntary sector are part of our social care teams and part of our discussions when we're looking at how can we support people best to support themselves. Social care isn't easy. It's tough, it's a hard job, but in Somerset, we hope, and I would hope, that if you came to join us, you'd enjoy the teamwork we have together, the experiences we do, and the people that we support.
Hello, my name's Vicky Bennett and I am one of the locality lead social workers in the Taunton Adult Social Care team in Somerset. I started in the adult social care team in 2015 as a newly qualified social worker, and initially I worked in the hospital team for a short while whilst I was awaiting my registration, but I also had opportunity throughout my study as a social worker to do a placement within the community team. I was then given the opportunity to do the locality lead development programme. This is a programme which is around supporting people to step up to do management roles. And at the end of that programme, which was approximately a year in duration, I was able to secure a role as a locality lead in the Taunton team, which is where I'm working now. There are so many opportunities in Somerset for training and to future your development and CPD. And as a result of that, I've literally just secured a secondment as well, doing I'm going to be working as part of the Mental Capacity Act and DOLS team, focusing on the implementation of the liberty protection safeguards. I've also just successfully been able to secure an opportunity to undertake my best interest assessor training, which Somerset are funding me to do, and that is through the University of the West of England in Bristol. One of the things that I think we pride ourselves on and that we do really well is our strong emphasis on our community and neighbourhood workings. I believe staff have autonomy, and we can create an openness and creative space for them to share their ideas, and part and parcel of how we do that is through our peer forums. I think we work really well as a team. We really value feedback, and I feel feedback as part of the work that I do around compliments and complaints. Feedback is really acknowledged and really valued. We offer good regular supervision. We have regular team meetings and support mechanisms in Somerset. Our staff are also supported to engage with strategic management, and we have regular Q&A sessions that are held with our director for adult social care and also the council leader, and that gives opportunities for staff to put forward any challenges or any feedback in terms of how changes that could be made to support them in practice, and those things I do feel are acknowledged and are listened to and are responded to.
Hi, my name's Pat Flaherty and I'm the Chief Executive at Somerset County Council, and I'd like to thank you so much for showing an interest in us and the work that we do. I relocated my family down to Somerset 16 years ago and I've never regretted that for one moment. The locality is beautiful. There's such a diversity of things to do. It's safe. It's a great place to live. It's a wonderful place to bring up children. It's one of the friendliest places you can imagine to live. Just some of the work that we're really, really proud of here in Somerset includes the work that we're doing to promote independence. We absolutely believe in the strength of individuals, of their family units, of the communities that they live in, to rally around and to come together and to help to keep people at home in their communities for as long as possible. Our promoting independence work model has been copied all over the country now, and we are rightly proud that the feedback from recipients of care, from care workers and from families is off the scale positive. Please come along and join that journey. Staff satisfaction is really high here at Somerset County Council, and we're very proud of that. I personally think part of the reason for that is because we talk. We talk openly, we challenge, and we have discussions. So, for example, every month I'm in front of about 800 or 1,000 members of staff, and it's open for anybody to ask any question, to air any issue that they're concerned about, and you're always guaranteed to have a really honest response and a really safe question and answer session. That's just part of the work that we do to make sure that we're open, that we're transparent, and we get to know one another. Being a social worker here in Somerset means that you have the freedom and the tools available to you to make a real difference to an individual, to a family, and in a community. We trust in you. There is nobody who can make such a difference to the outcomes for people in Somerset than you.